hello and welcome to today's webinar, Creating a Safe Space for Yourself and Others. I would like to begin by acknowledging the land in which we reside. McMaster University recognizes and acknowledges that it is located on the traditional territories of the Mississauga and Hoiwanchi nations, and within the lands protected by the Dish with One Spoon Wampum Agreement. My name is Kathleen, and I'm a program manager at McMaster Continuing Education. I'll be your host today, and I'm very pleased to have you join us to discuss this important topic. Today, I'm joined by our guest speaker, Elizabeth Wood. She's driving, if you didn't catch that. She's driving the slides too. I'll tell you more about Elizabeth shortly, but before we begin, a few brief logistics. If you have any questions or comments during the presentation, please click the Q&A at the bottom of your screen and type in your question. We will review all questions at the end of the webinar during the question and answer section as presented in the agenda. So, without further ado, I'd like to introduce Elizabeth Wood. Elizabeth Wood is the Executive Vice President of the CMI Financial Group, a multi-divisional group of companies centered in mortgage lending and administration. Recognized among Canada's top 50 executive leaders as the recipient of the Report on Business 2023 Best Executive Awards. Elizabeth is a solutions-oriented leader with expertise in organizational design, change management, policy development, and implementation, governance, project management, and strategic marketing. She is passionate about transformative corporate leadership with a focus on creating a safe, inclusionary, and open workplace. As an architect of CMI's talent strategy, Elizabeth has achieved gender partly while significantly scaling its employee base. In recognition of her trailblazing industry contributions, she was recognized as a Canadian Mortgage Professional Woman of Influence in 2019 and 2022, and a Canadian Mortgage Awards Woman of Distinction in 2021. Elizabeth is a dedicated mental health advocate and co-chair of the Canadian Lenders Association Diversity, Equity, and Inclusion Roundtable, where she advocates for the advancement and empowerment of marginalized groups in the financial services sector. She has earned an MBA, a Bachelor's of Commerce in Management, and a Bachelor's of Arts in Psychology. Elizabeth holds several industry-leading certifications and is an instructor and course content developer with McMaster University, an MCE Business in Marketing and Marketing Programs. And she is the treasurer of the board of directors of CIM Chartered Management Canada. Elizabeth, I'll hand things over to you now.
Thanks so much, Kathleen, and thank you all for coming. Trust me, they make me sound a lot better on paper than I am in person. I really appreciate everyone joining me today for a topic that is not only very, very close to my own heart, but also a topic that is never been more relevant than it is today. So I'm hoping to talk to everyone a little bit about creating a safe place in the workplace and a little bit about mental health awareness, advocacy, and how we can support everyone that we come across. I'm going to start by telling you all a little bit about myself. So kind of the story of Liz and why this is all so impactful to me. I had my first panic attack at age 10. Prior to that, there were no real indicators that I may ever come across a mental health problem. I had a normal childhood. I reacted normally to different stimuli. Perhaps I was a little bit more high-strung than most, but generally all was normal. And then at age 10, I went to an air show with my dad. It was a really hot day. I remember very sunny, probably didn't drink enough water, and I got a little bit lightheaded, maybe a little bit dizzy, a little bit nauseous. And instead of getting a drink of water and having a breath and getting on with the rest of my day, I had a meltdown, screaming, crying, a sense of impending doom. I was convinced I was going to die. My dad had to take me home right away. No one thought much of it. Perhaps I had just gotten a little overstrung, a little overheated. But those behaviors continued. Those symptoms continued. My parents put me in counseling, was diagnosed as a bit of a behavioral issue, kind of missed a few cues. So I started avoiding things I'd once loved. I stopped going up the mountain. I'm from Hamilton, and one of our largest malls is up the mountain. I stopped going there because I was afraid to. I stopped taking the bus because I was afraid to. I stopped going to the family doctor for vaccines and checkups because I was afraid to. I stopped taking medication for illnesses because I was afraid to. By 16, I had dropped out of high school. I could no longer face my classmates or the command performance of sitting in class. By 19, I refused to go anywhere. I didn't leave my street. I didn't go shopping, banking, school, doctors, dentists. I went nowhere. And from 19 till 32, that was my life. I simply didn't go anywhere. My grandfather passed away. I never said goodbye. My mother had a 9-hour life-saving surgery for a fairly serious cancer diagnosis, and I wasn't by her side. I never went to the doctor. I didn't undergo screening. I didn't go to the dentist. I simply didn't live. However, during that time, I did earn 3 degrees. I advocated for myself and I received accommodation through a number of different universities. I started a business. That was my solution to earning money because I couldn't find any employers that would allow me to work from home. So I started a business. Through that business and through my education, I did discover 2 employers, McMaster being one of them, that were willing to accommodate my unique needs. And I'm now an award-winning executive with one of the largest private lenders in the country. I did all that with only a very few people knowing how much I struggled. Only my closest friends and closest family and highest echelons of those employers knew exactly what I went through. Only they knew that I suffered daily with severe crippling panic attacks that wouldn't even allow me to leave my front porch, that I struggled with believing I had a deadly illness, a new one every week, that I would spend hours in the black hole of Dr. Google searching up symptoms and convincing myself that there was no way I was going to make it to the next day. Eventually, it all came to a head. March 2020, we all entered into the global pandemic. And for myself, the first 3 months were fine. Many would think, well, Liz, nobody could leave the house. It's literally your ideal environment. And I joked around with everybody that now that I had been training for this my entire life. But the fact is, like everybody else, I was seriously impacted. And it got to the point where I could not leave my bedroom. I was suffering from 6 to 8 panic attacks daily. And I took a medical leave from work. And that was a big decision. But I had no choice. There was no path forward for me otherwise. And I found myself in intensive treatment. Now, you might ask, why did I not seek treatment sooner? Why did I spend 20 years living in this lockdown of sorts? And the fact of the matter is, treatment wasn't available to me. My parents, from the time that I was 14, 15, till I was in my early 20s, fought the medical system to find me help. My husband stepped in as my advocate, called dozens of psychologists and psychiatrists from the Yellow Pages and eventually Google searches. Nobody was willing to treat me because they wanted me to attend their office. Of course, I couldn't leave my house. It was the proverbial catch-22. The pandemic, however, with all the negativity that it brought, gave me an opportunity for help because suddenly those virtual services were available. So I found a psychologist, a clinical neuropsychologist, and at age 33, after more than 20 years of struggling with my mental health, was officially and formally clinically diagnosed with generalized anxiety disorder, illness anxiety disorder with obsessive features, panic disorder, agoraphobia, not a standalone illness in my case. Mine was directly tied to my panic attacks, comorbid depression, which is slightly different from major depressive disorder in that mine was directly tied to my anxiety disorder, and post-traumatic stress disorder. So for 20 years, I had walked around with all of these mental illnesses, ignoring them, shoving them aside, and not getting help because I didn't think there was any help to have. So at 34, I went back to work and I felt empowered and I felt I was ready to say something, to speak out loud. And I did a LinkedIn post, a short post, just describing some of the facts of my day-to-day life, how long it's been since I've done some of what many people would consider normal activities. And the response was overwhelmingly positive. I received hundreds of reach outs from people who were not only engaged with me and my story and wanted to support me and show how much they cared and how proud they were of me, complete strangers, but also to let me know about people they loved or themselves going through this. And it was an eye-opening experience. And from that moment, I became driven to give a voice to those that are unable or simply unready to speak out for themselves. So that's a little bit the story of me. Probably not as exciting as you were hoping, but it's a little bit about why we're here today. So moving forward, I want to discuss just a little bit about mental health by the numbers. So statistically, in Canada, by age 40, about 50% of our population will actively have or will have already had a mental illness. So nearly half of our population will have struggled with mental illness by age 40. In any given year, 1 in 5 Canadians, 20%, experiences that mental illness. Now, mental illness currently accounts for more than 30% of long-term disability claims and costs approximately $56 billion in lost productivity in Canada as a result of people being unable to attend work or struggling. More than 500,000 employees are off work every week as a result of a challenge with mental health or a direct mental illness. Globally, we estimate that 12 billion working days are lost every year to just depression and anxiety. That's a cost of US $1 trillion in lost productivity. And mental health related disability is continuing to climb year over year by an estimated 2%. But unfortunately, nearly 40% wouldn't tell their manager that they were struggling with a mental health challenge. And 43% have said that they would like to receive more support from senior management and human resources. That's why webinars like this and discussions like we're having today are imperative for us to be able to move forward as a community and as a society in supporting those that need our help. So I really briefly want to discuss the difference between mental health and mental illness. Many people put them together and lump them under one heading, but they are actually different. And for clarity, I am going to refer to mental health challenges throughout this programming, and it's going to encompass everything we're going to discuss. So it's going to include mental health challenges without mental illness. That will include mental illness, and that will also include addiction. However, it's important that we understand they are not the same. So oftentimes, when people think of mental health, they think of anxiety, depression, bipolar, schizophrenia. More often than not, people are equating mental health challenges with mental illness. However, mental health and mental illness are not the same. Mental health is referring to the state of psychological well-being that we experience at any time. And this can vary. This can vary day to day. This can vary hour to hour. This can vary minute by minute. To illustrate, you may get up in the morning and you're feeling strong and empowered. You're excited, you're motivated, you're engaged. You have strong mental health. Throughout the day, various things happen. Your dog gets sick, your boss yells at you, a presentation falls apart, you get stuck in traffic, you break a tooth. By the end of the day, you're exhausted, you're worn out, you're disenfranchised, and your mental health has now decreased. Neither of those are directly related, in most cases, to mental illness. Mental illness is disturbances of thoughts or feelings or your perceptions that directly impact your day-to-day functioning, your ability to cope, and usually in a negative way. So these are actual alterations in how you're perceiving a situation or yourself, others, or behaviors, and your interpretations are then leading to negative coping. It's not only possible, but actually very common to have poor mental health and no mental illness, or by contrast, mental illness with sound mental health. To illustrate, somebody with schizophrenia would be defined as having serious mental illness. But if they're under treatment and it's successful treatment, their medication is working, they're working, they have their jobs, they have strong social interactions, they have strong mental health and severe mental illness. By contrast, somebody can have no clinically diagnosed mental illness, but have an inability to get out of bed with fears of sadness, desolation, and a lack of hope. They don't have mental illness necessarily, but they have poor mental health. So while these are often correlated, they don't necessarily operate in lockstep. And that's important to keep in mind as we work through the rest of the slides and think about how we can create safe spaces for people. So oftentimes people who are struggling with their mental health are perhaps not comfortable coming forward to say so. Many times they may not feel like you're open to hearing it, or like the individuals or the audiences are going to understand what they're going through. We also worry that perhaps it may make us less than somebody else. So if people don't tell you something's wrong, how can you know that something is wrong? You can look for nonverbal cues. And there are typically two different types of nonverbal cues. There are positive nonverbal cues and negative nonverbal cues. And just for clarity, when we talk about positive or negative, in this case, we're not talking about good or bad. We're talking about the presence of or the removal of a behavior or an action or an activity. So nonverbal negative cues, again, these are removals of things, can include frequent tardiness or absenteeism, withdrawal from work groups or functions, or a decline in their performance, their accuracy, or their effectiveness. Now, it's important to note that when we look at nonverbal cues, we are looking at trends. A single time that somebody is late for work is not necessarily an indicator that there's a problem. But when there is a steady and ongoing or increasing change in the pattern of someone's behavior over a period of time from where they once were, that is not always, but can be an indicator that perhaps they're struggling with their mental health. So when we think about negative cues, this may be somebody who used to always be on time for work, always delivered their presentations or reports on time. They were engaged, their work was always correct, rarely was there errors. And now perhaps they're late regularly, or they're calling in sick far more than they did before. Maybe their work when they hand it in is full of errors, or they're frequently needing more time. Because that is a change in an expected behavior, and because it is an ongoing change over a period of time, that may be construed as a negative nonverbal cue. Positive nonverbal cues are, as they sound, exactly the flip side. So this could be a sudden increase in availability or engagement, a willingness to take on excessive amounts of work or responsibility, or frequent reassurance seeking or requests for external validation. For clarity, this is something that I struggle with. This is what I tend to do when I'm having difficulty with my mental health. I will raise my hand and offer my support wherever it's needed, take on work that's probably far beyond what I should. I will ask frequently, did I do a good job? How was that? Do you think they liked me? Do you think they believe me? Should I have spent more time? Did I miss anything? And when people are doing this, they're often doing battle with their own self-perceptions. So if suddenly you see an increase in these behaviors, again, outside of their normal pattern of behavior, that can be an indicator that there is potentially a mental health challenge. So when we think about coming across somebody who may be struggling with their mental health, one of the easiest and most effective things we can do is choose the right words. However, it is very imperative that we allow the individual who may be struggling to guide the dialogue. Sometimes the phrases that come to us most naturally are actually the same platitudes that can diminish or minimize or even perpetuate the stigma of mental health. I'm going to give a few examples of what I've experienced over the last 20 years. There are obviously many others, but these are some that I've experienced and that research has shown can be particularly troublesome. For example, you just need to relax and calm down. If somebody with mental health could, they would. Nobody likes feeling anxious or stressed. Nobody likes feeling overwrought. When we say to somebody, just relax, just calm down, we're minimizing and diminishing and invalidating what they're experiencing. Remember, when somebody has mental illness or somebody is struggling with their mental health, what they're experiencing is real. Whether it's irrational or their perception is incorrect is not what's at stake. What's at stake is they're experiencing it, and we don't want to invalidate that. It's all in your head. Precisely. We know that. That doesn't make any symptoms or emotions any less impactful. Most people with mental health challenges are aware that it doesn't make sense, that their reaction, their emotional and physical reaction to whatever that stimuli isn't really in alignment with what's occurring, but it doesn't change the fact that that's what they're experiencing. And so to tell them it's all in your head, don't worry about it, is actually diminishing what they're experiencing and reinforcing that there's something wrong with them. Have you tried not thinking about it? Sure, all the time, but that rarely works. It's kind of a defining feature of mental health challenges. Telling somebody, just put it out of your mind. Don't worry about it. Ignore it. They would love to. If that was an option, they wouldn't struggle the way they are. Again, these types of dismissive word selections is actually a big part of what forces people to hide and creates an environment where they don't feel comfortable moving forward. So instead, what can we do? We can try asking what they need instead of assuming that we already know. Now, for clarity, there is a lot of information about this out on the internet and on social media. And a lot of people say, never ask a person in crisis what they need. It's not fair. You could overload them. And that's very true. A lot of people who are struggling with their mental health don't know what they need. It's taking all the strength they have to put one foot in front of the other and to get the job done. However, it's all about the perception of our behavior that makes the difference. So we can try, what can I do to support you right now? Is there anything I can do to help? You may not get a response. They may simply not know. So what else can we do? If you need anything, I'm here for you. Let people know that you're an option, that you're a resource to them. Alternatively, try to select something that you think might be helpful and ask their permission to support them. Don't just buy them groceries or arrive to pick their kids up. That may make them feel like you believe they aren't good enough, that they can't handle it. But make the offer. Perhaps if you know that maybe their spouse is gone, their partner's away, and they're struggling to balance the household, say, you know what? I'm taking Susie to the park on Saturday. Would you like me to take Mark with us? They haven't seen each other in a while. Make it an open invitation, but let them maintain the control of what they need. And lastly, just remind them that you're proud of them, that you do see the struggle, and that the fact that they're continuing to push forward every day and to find ways of putting one foot in front of the other to get it done is what's impressive. It doesn't matter when it's done. It doesn't matter how it's done or how fast it's done, but the fact that they keep on fighting and simply telling somebody how proud you are of them and how much their strength matters to you can make all the difference. So now that we've discussed sort of mental health, mental illness, and communication as a whole, let's start looking at how can we implement this in a workplace. So when we think of a workplace, we think of a dynamic, employee versus employer. But it really shouldn't be like that. An employer and an organization, a firm with supported employees will always be more productive and more effective than one without. So how can we implement certain strategies? And what are those strategies to ensure employees feel supported? Start by being transparent and open as a manager or as a leader. Lead by example and share your own story. Now, you may not have struggled with mental health yourself or mental illness yourself. You may not even know anybody that did. You may not have been part of that. But simply sharing that you were open, for example, to attend this webinar, that you made a conscious decision to develop skills and understanding to support them, will demonstrate to them that they have a safe place with you, that you are an inclusionary person that they can share their true, authentic selves with. Offer mental health days, but don't define them as such. Don't label it a mental health day. For a long time, everybody thought we should have mental health days in the workplace. The problem with labeling them as mental health days is that then everybody who takes them has to admit that perhaps they're struggling. Not everybody is ready to say that out loud. We don't want to ever force someone to disclose something they're not ready to. There are many people that elect not to utilize those mental health days because they don't want to admit they need them. Instead, we can call them something generic, like a personal leave day or a free day. Implement training for managers. Education and awareness is key to fostering active listening and proactive intervention. Whether it's a webinar like this one or a formal training class, a compendium of documentation, ensuring that the management team is brought together in a unified approach to both recognizing and addressing mental health challenges in the workplace is absolutely instrumental to building a strong and supportive environment where all employees can feel like they can be their authentic selves. Make resources available. This seems like an obvious one, and yet many firms I work with don't have this in place. When I say make resources available, it can be very, very simplistic. Some websites like the Center for Addiction and Mental Health or the Canadian Mental Health Association are great resources that we can link directly to strategies for coping with mental health challenges, to screening questions to help identify them. Psychology Today has a wonderful search feature that can allow people to connect with mental health practitioners. In fact, more than 70% of people who struggle with their mental health that are not in treatment say that the reason they're not is because they don't know where to look. So we can create these resource packages, make them available somewhere where they can access them anonymously. And that last piece is the most important, whether it's hosted on a corporate intranet, whether it's simply a file sharing folder on a SharePoint drive, making sure that these resources are available in a way that somebody can access them and nobody could ever know they did is going to increase the likelihood that someone will engage and seek help when they need it. And finally, build a connection. We talked a lot about nonverbal cues earlier, but how can you recognize nonverbal cues if you don't know who they are? Get to know them, whether it's weekly or monthly meetings, building up a communications program, perhaps having people fill out surveys so that you understand who they are. Learn their work, create a log to recognize what their deliverables look like. What are their patterns and trends? What are your expectations of them? By doing this, you'll be able to better identify trends and patterns that may or may not identify when there's a problem, and that may also help you identify what their stress responses are. If possible, try to connect with them on a personal level. Who are their children or their pets? What are their hobbies or important dates in their lives? Make them people, not just employee numbers. So I did just want to kind of summarize a little bit with a bit of a cheat sheet. The strength in numbers and how we can support and care, the do's and don'ts, if you will, of handling mental health challenges, especially in the workplace. So let's start with do not. Do not placate, diminish, or minimize. This invalidates their feelings and experiences. What they feel is valid and real. Acknowledge it. And when we're talking about that, what we mean is don't use the verbiage that implies that what they're experiencing is not real. Don't tell them to forget it. Don't worry about it. Ignore it. Relax. It's no big deal. It is a big deal. To them, it's a big deal. I can assure you the physical symptoms are very, very real. And at the time we're experiencing it, our interpretation is far more real than yours. You know, when I'm having a panic attack or when I'm convinced I'm dying of a brain tumor or that my boss is firing me tomorrow because I screwed up a presentation, there is nothing you can say that makes more sense than my argument. My anxiety monster, as my psychologist and I call it, has really, really good arguments and a lot of really good evidence when I'm feeling down about myself. So to diminish somebody by saying, just ignore it, it's no big deal, is telling them that their feelings, their perceptions, and their experiences are no big deal. So we want to avoid minimizing and diminishing their experiences. Also, don't incorporate your perceptions of their struggles when you're assessing their performance or their needs. This is a huge fear for many employees. They worry that if they're honest about what they're experiencing and what they're going through, that they may be overlooked for a promotion or for a new responsibility because their boss or their manager is going to see them as unfit. So it's really important that you make it very clear when you're discussing these issues that these are not factored into your assessment of their performance, that you recognize them as separate and not part of true job performance. Most importantly, do not assume you know what they need. Your story is not theirs. No one experiences mental health challenges the same way. At the end of the day, it's up to the person with the struggles to define their roles and their needs for you. Don't take away work because you think it's going to help someone who seems stressed or overloaded. The message you may actually send, instead of being one of support and acceptance, is You're not good enough. We're taking this away because we don't trust you. We see you struggling. Just be very cognizant of how it could be interpreted from a troubled mind. What can we do? Build in reasonable accommodations. Allow for things like flex work or flex time. Don't mandate video calls and offer additional personal leave time. When I talk about don't mandate video calls, this is a bit of a hot topic, so I understand it may be controversial. I'm not talking about the mandatory video calls that we know are needed in the day-to-day workplace. There are times when being on video is absolutely integral and has to be part of the job. But if these are just regular follow-up meetings, maybe team meetings with a group, if it's not absolutely imperative that they be on screen, consider allowing them the choice. A lot of people feel very uncomfortable being on screen, especially when their boss is in the room. And it could be for a variety of reasons that may seem silly. Again, using myself as an example, I always get nervous about being on camera. I'm nervous now, but I'm especially nervous when I have to meet with my boss. Why? Because my dogs have a really bad habit of joining me on screen, and they're not small dogs and they have no manners. So I'm always very self-conscious, and I spend the majority of the meeting worrying and fretting that my dog is going to join me on screen, or my 10-year-old is going to run in screaming, my cat's going to start meowing, the vacuum is going to go off, some nonsense is going to occur, and I will be seen as less than. So if you don't have to have it on video, if there's no requirement, if there's no benefit being derived from video, consider not mandating it. And again, additional PLE, as discussed earlier, don't call it mental health days. Just give people time away to sort out what they need, time away. Sometimes they just need a day to restructure or to come up with a solution or a strategy for overcoming something that's occurring in their life. Enforce a return to work program that's built in collaboration with the individual. If people do have to be gone for any extended period of time, 3 days or more, consider talking to them and collaborating with them on what their return is going to look like. When I took my leave, I was gone for just over 3 months. I worked with my employer to find a solution that made sense for me. Forcing somebody right into the role that they had left can be overwhelming. Also consider how their leaving and return is going to be communicated to the people they work with. Again, it's all about being supportive and not making them feel less than or called out. And the last thing that anybody can do, and I really hope you take away, if nothing else from this entire presentation, take time out to remind them they are enough. One of the most commonly quoted themes that we hear when we talk to people about mental health and how they feel, especially in the workplace, is that if they admit that they have a problem, they're somehow not enough. They're no longer good enough. They're not important enough. They don't deserve to be where they are. Carve out that minute, take them aside, and remind them that irrespective of any challenges they may have, they are no different, no better, nor worse than anyone else. That they, in who they are, warts and all, are enough. These are just some resources that I hope everybody will take away from this. The Center for Mental Health and Addiction and the Canadian Mental Health Association both have some amazing resources on strategies that you can implement in the workplace as well as in your own homes. The World Health Organization has a myriad of fact sheets that can be very helpful in supporting some of your management training and leadership training so that people can understand the impact of mental health challenges, especially if they're left untreated. And then workplace strategies for mental health. This is an absolute amazing website that has so many strategies for supporting and empowering individuals in the workplace that are struggling with their mental health. So again, if anybody has any questions or wants any other information, wants to discuss some strategies for implementing a safe workplace, you can also reach out to me directly. My email's on the screen now. Other than that, I really want to thank everybody for taking the time to join me today, for letting me share my story and be open with you, and for being open to finding ways of supporting others that may be struggling. I very much appreciate it. Kathleen, that's everything from me.
Thank you so much, Elizabeth. There was a lot of it. There was a lot in there. And there's a lot for us to take away and reflect on. And I'd encourage everyone, if you can, please stick around for a little bit. We have some questions to go through in the chat. But first, I'm going to tell you about some programs that we have at McMaster Continuing Education that would be helpful to your journey if you're looking to create and support safe places at work. Elizabeth, can you move to the next slide, please? You may want to look at course in mindfulness in modern society. There's 3 courses, and you learn the history and the foundational philosophies of mindfulness, neuroscientific benefits and psychological effects of mindfulness, and different types of meditation is one of them. And next we have Wellness in the Workplace. This is a course that just happens to reside inside of our human resource management program. But if you're not a human resources professional, don't worry, you can take this too, because there's lots of people who want to be champions for wellness in the workplace. And the next slide, Elizabeth, please. Adventures in Psychiatry. This is 3-week online course. They're a short course, very collaborative. So I would encourage you, if you want to look at, some of the options that are out there, this might be a good course to investigate in. I had been looking at some of the comments that say, my family doctor just doesn't understand. And oh boy, have we heard that loud and clear, both professionally here at McMaster and of course, in my personal journeys with myself and other friends. Finding the right caregiver, the right physician is so important. And we have a very complex healthcare system that's very overwhelmed. So this would help you navigate and know where to go. Please do contact Continuing Education at McMaster if you think there might be a course, or short course, semester-long course, or a program for you, because we really have fantastic instructors like Elizabeth working with us. So have a great rest of your day, everyone. Take care.
Thank you.